You are listening to Star Podcast.
Hi, I am Dr. Vishwak Sena Reddy, consultant neurosurgeon, Star Hospitals. Today we are going to celebrate World Spine Day. Taking place on October 16th each year, World Spine Day highlights the burden of spine pain and disability around the world. World Spine Day highlights the importance of spinal health and well-being, promotion of physical activity, good posture, responsible lifting, and healthy working conditions will all feature as people are encouraged to look after their spines and stay active. An estimated 1 billion people worldwide suffer with spinal pain. It affects people across the life course and is the biggest single cause of disability on the planet. Back pain can happen when mechanical or structural problems develop in the spine, the discs, muscles, ligaments, or tendons in the back, or when it compresses a nerve. It can be due to a sprain, where the ligaments are twisted or they are strained. Second most common cause is the degenerative disc disease, a herniated or ruptured disc. It can be due to slippage of one bone, one vertebrae or the other, which is commonly termed as spondylolisthesis. It can be due to age-related narrowing of the spinal canal, which is called as spinal stenosis. It can be due to trauma, where there can be a fracture of the vertebrae. It can also be due to some structural changes in the spine leading to changes or the change in the curvature of the spine called scoliosis. There are also other conditions like the inflammatory conditions like ankylosing spondylosis. It can be also due to other medical conditions like osteoporosis, fibromyalgia. Apart from spine problems, the back pain can also be due to kidney stones or infections. It can be due to gynecological related issues related to conditions like endometriosis. It can be due to urinary tract infections. It can also be due to tumors of the spine or related areas in the back. So, what symptoms are important and when we should be seeking medical attention? See, whenever the pain the patient is having back pain, apart from back pain, if the pain is radiating or coming down your legs, if it is associated with tingling or numbness like sensation in your feet or hands, if there is associated back pain, especially after a fall or an injury, and whenever the patient has symptoms like troubling symptoms like the pain is not subsiding with any medication, any bed rest, patient is having trouble in urinating, whenever it is associated with weakness in the legs or the limbs, whenever it is associated with weight loss, and whenever the patient is having associated fever, all these things are the warning signs related to back pain related or spine related issues. How to avoid back pain? The most common way by doing which we can avoid back pain is maintaining good weight, ideal weight as per your height. Do regular exercises. If you are a smoker, you should quit smoking. We need to take adequate rest. A good proper sleep is important, and we should definitely pay our attention to posture, how we sit, how we work on the system, how we walk, what kind of footwear we wear, and at what posture, the posture while you're sitting, how your desktop is, how your laptop is positioned. All these things contribute to your healthy spine. So if we are not taking care of these things, you may strain your back and it may lead to mechanical back pains. Another important aspect of it is taking breaks in between. So prolonged sitting over a system working, all these things are contributing to the bad health and spine related issues, especially in youngsters these days. So we should take by maintaining good posture, taking breaks in between your work, and another important aspect of taking care of your spine is how you lift the weights. So instead of bending completely and lifting the weights, we need to sit on our thighs or legs and keep the back straight, and so that the burden falls on the legs instead of your back. And definitely certain changes in your things like avoiding high heels, not wearing skinny or very tight jeans. Another important aspect is a wallet. So some people have the habit of stashing their wallets with the cards or visiting cards or whatever it is, and that can lead to and sitting with a wallet on your back. So that can have a serious side effect on the posture or the positioning of the spine, and that can again lead to back pains. Another important aspect is we need to pick the right handbag or briefcase. So we need to buy certain things which are adjustable with a strap, or see that it's not pulling down one side of your arm. So all these simple things, if we take care of, so most of the times we can avoid back pains. And even if someone has back pain, we can treat it by simply doing these certain changes in their day-to-day routine, and most of the times we can avoid taking medication. So what advancements have happened in the treatment of spine related issues? The most important aspect of it is like we have a thorough knowledge of what exactly is causing the back pain. And most of the times, like in the previous years when the investigations were not adequate, apart from your clinical judgment, investigations like an MRI or x-rays, depending on the situation, we order for. So these exactly and precisely tell us where exactly is the problem, and if they are the symptoms apart from the back pain, if the symptoms are like in the warning symptoms. So we need to understand what exactly are the warning symptoms, like pain coming down your legs, radiating pain, numbness in the legs, all these things. Apart from these things, you can also have, if the patient is having loss of control over urine or passing stools, these things or these symptoms are very dangerous. So these patients, most of the times, if there is a clinical evidence of a severe compression on the spine, they need to be operated on. So not every case needs operation or a surgery. Only when the compression is so severe that it cannot be relieved with simple exercises or medication, that is when we order for a surgery, or we suggest a surgery. So if the warning signs are there and still the patient wants conservative treatment, most of the times we can end up with doing a complication, or the patient might end up to the OPD with a complication. So if needed, the surgery, unlike the conventional open procedures, what we have is the endoscopic spine surgery, where instead of giving the big cuts and cutting out the muscle and cutting out the entire bone, we can give a small incision of about 7 to 1 centimeter, 7 mm to 1 centimeter, and by passing a small scope, we can address the problem. So the recent advances are, most of the times, try to what we have understood, and when there is an indication for surgery, we can definitely try a endoscopic spine decompression. Another important question is, when should patients seek, or what are the indications if needed for surgery? So most of the times, back pains can be treated with simple physiotherapy exercises related to spine, by doing good posture correction and certain medications. Only when the symptoms are not getting relieved and evidence of a compression in the cord or the nerve root or the spine, that these symptoms, if the compression goes to the extent that it is not curable with physiotherapy or the conservative management, that is when we suggest a surgery. Not all mechanical back pains, not all spine related issues need surgery, definitely. So when indicated, if the patient is having severe back pain, or the pain coming down to his limbs or her limbs, and patient is having numbness in the limbs, patient is having bowel and bladder related symptoms, patient is not getting relief with a conservative trial, that is when probably we will need a surgery. But before surgery, for suppose the symptoms are mild but it's a chronic problem and the compression is not much, we can offer certain injections where we can give it to the spine, and these can help in alleviating of the pain. So not all patients need surgery. Most of the times we can manage them with conservative management. So the advanced treatment at Star hospitals, as part of it, what we have been doing is, when indicated, instead of the conventional open surgery where the cuts or the incisions are big and we need to cut out the normal tissue to reach the abnormal tissue, what we have been practicing is endoscopic spine surgery, where the incisions are small, the muscle or the normal tissue is not much damaged. So by decompression can be done by passing in a small camera and instruments. And most of the times, as the normal tissue is not damaged, the recovery of the patient is fast. They can be back to their work at the earliest in couple of days. So apart from the endoscopy, what we have been offering is the lasers and the epidural injections, or the facet blocks or the root blocks. All these things helping alleviating of the patient's pain. Depending on the level of compression, the treatment has to be tailor-made.
Thank you for listening to Star Podcast.